My pleasure.
I'd also like to welcome everyone here on behalf of the Institute for Mental Health Research. As Angel said, this is our second webinar in our series on COVID-19 and mental health, and we're happy that you chose to spend some time with us today. If you joined us for our first webinar, welcome back, and thank you for your suggestions and feedback. We've actually incorporated many of those today, so again, thank you. Before we begin our program, I'd like to tell you a little bit more about the Institute. The Institute, as Angel said, provides grants for early stage mental health research so that scientists can build a foundation of work in order to apply for and garner greater amounts of funding from larger institutions, such as the National Institutes of Health. IMHR has funded 52 projects, 37 scientists at 10 different institutions across Arizona. For the $2 million that we've granted, those scientists have gone on to receive $20 million in research funding from those larger institutions. I think that's a nice return, not only to the scientists, but to our institutions and to our Arizona economy. And most importantly, they are unlocking those answers that we need to live better and fuller lives. We like to say small investment, big returns. So this year, we've chosen to focus our funding efforts on research addressing COVID-19 and mental health, both the effects of the pandemic due to isolation and trauma, but also the effects of the virus itself on the nervous system. The mental health effect of COVID-19 has been described as a coming tsunami, and we want to get a head start in meeting the challenges it will pose for years to come. Our webinar series highlights some of our issues and solutions that are being researched here in Arizona. We would love to join you, or we would love for you to join us in our work, and we'll talk a little bit about that at the end of our conversation. I'm delighted now to turn it over to Dr. Keith Cernick, the rest of our program. He is the Institute's Chief Scientific Officer. He directs our grant award process and liaisons with the scientists and our Scientific Advisory Board. Dr. Cernick is the former chair of the Department of Psychology at ASU, and as a clinical psychologist, he himself has published extensively on child development and family development. I'll turn it over to you, Keith. Thanks.
Thank you, Mitzi, very much for that introduction. And welcome again, everybody. We're very glad to have you all here. And it's my pleasure to introduce our speaker today, the multi-talented and brilliant Michelle Lani Shiota. Dr. Shiota did her undergraduate work, and well, I'll just say flat out, I think she has a very impressive sort of academic pedigree, right? With her undergraduate work at Stanford, her doctoral work and postdoctoral work at University of California at Berkeley. And she is currently an associate professor of psychology at ASU, and also directs the Department of Psychology, Social Psychology area. Lani is an eminent and nationally acclaimed social psychologist. She was recently named a fellow of the Society for Personality and Social Psychology, and was previously named a fellow of the Association for Psychological Science. Her research interests have centered on emotion and emotional processes in interpersonal relationships. Particular interest of Lani's is in positive emotions, which is sort of unique because I think in many ways people have focused much more often on more negative emotions, but Lani's focused her work really on the more positive end of the scale, researching a number of them, but in particular is uniquely known for her work on the concept of awe and what is awe-inspiring in many ways, and that's incredibly interesting work. She's published extensively on these topics and is one of our country's foremost experts in the field. Her research, not surprisingly then, has been funded by the National Institutes of Health, also by the Templeton Foundation, and by the National Science Foundation. She's currently got a project funded by NSF, and that project is on coping with COVID-19, in which she explores emotion regulatory strategies for managing behavior, social outcomes, and psychological well-being. And this is the work that IMHR identified that was so critical that we wanted to try to help be a part of supporting that effort, to which end we have supplied Dr. Shiota with a micro grant to help with the work that she's doing on COVID-19. So we're going to hear about that work today in her presentation on emotion regulation, social connection, and well-being in the face of the pandemic. Please join me in welcoming Dr. Michelle Lani Shiota.
Thank you so much, Keith. That was a really generous introduction. It's lovely to see you. It's always lovely to talk with you. I always want to thank Angel and Mitzi for the very kind invitation to do this webinar today and to share some very, very, very preliminary findings of this recent work that we've been doing. And I hope you find it interesting and helpful. The questions that we wanted to ask in this line of work involved not just how people are coping with the extraordinary stress of this situation, but what the implications are. And we wanted to ask that question in a different way than it's often asked. I think all of us in one way or another can relate to the unique nature of both the individual stressors and the combination of stressors that we have been facing over the last 6-8 months. They are really quite unprecedented in modern history, at least within the US. And it's very widespread, and different people are experiencing a different combination of stressors, right? There's economic stress, there is work stress for families with children, especially young children at home. There's the stress of figuring out how to provide the appropriate childcare and support for their education, while also in many cases getting your own work done and working from home. There's the stress of getting groceries. There's all kinds of new challenges that we were facing. And as I was thinking about this during the early weeks, I thought, wow, this is not only an extraordinarily difficult situation, but also an opportunity to learn something about how people respond to such a complicated situation from an emotion regulation and coping standpoint, and what the implications of different approaches are. There's a very, very large body of research in general on the extent to which the use and reliance on particular emotion regulation and coping strategies is associated with psychological well-being under normal life circumstances. These are not normal life circumstances. This is a really ratcheted up stress situation for many people, if not most people. Moreover, it's a situation in which we not only need to deal with our emotions, but we also are strapped for behaving in healthy ways. And in particular, the need to enact what for most of us are unusual and novel behaviors related to health, particularly social distancing and hygiene behaviors. So we turned to NSF to ask if they'd be interested in supporting a new line of research addressing these issues. So the questions that, and it was already at that time very clear that the pandemic was having significant mental health impacts. So in May, a study conducted by the US Census Bureau found that 1/3 of Americans were reporting significant mental health symptoms. About 20% of Americans were showing symptoms of both anxiety and depression, and another 15% or so were showing one or the other. And this is considerably higher than would normally be expected at any one point in time. Even earlier than that, in March, a Kaiser Family Foundation poll found that the majority of Americans, or a substantial plurality of Americans, were reporting impacts of worry or stress around the coronavirus on their mental health, with approximately on average 16 or 17% reporting major impact on their mental health, and then another approximately 25% reporting a minor negative impact on their mental health. And part of what is striking is that this was true both for people who were sheltering in place, who were not leaving their homes to go out to work, who were really kind of housebound, and for people who were not sheltering in place and who were having to go into their workplace every day for economic reasons, that the stress was really quite widely distributed. But if anything, was even stronger among people who were sheltering in place. And increasingly, questions started to be raised about the implications of loneliness and social isolation for mental health on top of the other stressors that we're facing. And I'm going to talk about that quite a bit today, because it turns out that our relationships with other people play an important but complicated role in how we're adapting to this situation. The work that I'm going to talk about today addresses three questions. The first is, how have people been coping emotionally with the coronavirus pandemic? And I'm going to present data that we began collecting in around the middle of April and continued collecting through about the middle of June. What emotion regulation coping strategies are associated with better psychological well-being? And then, are emotion regulation and coping strategies also related to healthy lifestyle behaviors that people have been exhibiting in this time? Now, I'm going to talk about data from two studies today, and rather than talking about them separately, I'm just going to kind of combine them, guessing that what most people are really interested in is what we found and the implications of that. In the first study, we used Amazon's Mechanical Turk platform to recruit 520 adults throughout the United States. It started with a larger sample and removed folks who showed that they weren't paying attention or completed the survey too quickly, or showed basically answers that indicated that they weren't taking it seriously. We asked each of these participants to rate their use of 17 specific strategies for coping specifically with pandemic-related stress in the last 24 hours. And that focus on pandemic-related stress is going to be important as we discuss the meaning of the results that we have. We used a statistical technique called exploratory factor analysis to take those 17 different strategies and say, can we identify some clusters of strategies, and what do those look like? Because it's a lot easier to analyze 5 or 6 different clusters of strategies and understand what that means than 17 distinct ones. And our results suggested actually that we had 7 distinct clusters, which I'll show you in a minute. In the second study, we wanted to look at the relationships between coping and both psychological well-being outcomes and health behavior related outcomes. This study included a final sample of 297 adults in Arizona and California. They were recruited via Craigslist, and each participant completed 22 consecutive days of surveys. Now, this number of 297 is people who successfully completed the first day, and we had no concerns about whether they were who they said they were, they appeared to be paying attention, and so forth. Some of those folks will end up having dropped out throughout, but today I'm going to focus on day 1, just the baseline data, the first day of surveys. Every day in this study, they completed an assessment, again, of the coping strategies that they used, same one that they did in study 1. We also took daily measures of their sugar intake in terms of sugar-sweetened beverages and sugary treats and desserts, their alcohol intake, their tobacco use, exercise, sleep, and 2 different daily measures of how close they felt in their relationships, both to their household members and then to the most important people in their lives. On the first day, and every 7 days thereafter till the end of the study, we also took questionnaire measures of symptoms of depression, anxiety, and stress, levels of positive and negative affect, and then the extent to which they engaged in a series of healthy social distancing, hygiene, and safe social engagement behaviors, as well as prosocial and antisocial behaviors. I'm not going to talk about all of those today, but be really selective in showing you the most interesting preliminary findings that we've got right now. And again, today's analyses are going to focus on relationships that we're observing among our variables during the first day of participation. Let's kick into the first question. How have people been coping emotionally with the coronavirus pandemic? Well, I mentioned that we identified 7 clusters. Let me walk you through those now, because those are going to become increasingly important as we start talking about relationships. The first cluster we called action-focused strategies. This included planning and problem solving for ways of dealing with the challenges that the pandemic presented us, and then also information seeking and what we call detached reappraisal. An example detached reappraisal item was, I tried to think about the situation in a detached and unemotional way. So it's really focusing on facts, kind of disengaging from the emotional implications of the situation. The second cluster we observed, we called positive affect inducing, and that includes strategies like positive distraction, playing puzzles, watching TV, doing other kinds of fun activities. It included humor. It included what we call positive reappraisal, which is trying to think about silver linings in the situation. So for example, people who were working from home, some found that very difficult and challenging, but others found it actually kind of nice to not have to worry about getting dressed up and go into work, and maybe have a little more time with your pets and in some cases your kids during the course of the day. And the final strategy that went into this bin we call savoring. And that is simply taking some time in the middle of the situation to enjoy something pleasant in a healthy way. So it's really taking time to stop and smell the roses, even though what's going on around you is challenging. The third category we called social connection, and this included 3 specific strategies. The most obvious one is seeking emotional support. It's turning to friends and loved ones, people you trust, and saying, hey, I'm struggling right now. I'm under a lot of stress. I'm hurting. Can you support me emotionally through this? But it also included seeking practical support. Can you help me by dropping off groceries? Can you help me solve this problem or get this information that I need? And then we also put into this category, and it seemed to cluster with the others, healthy socializing. So just reaching out to friends through Zoom, through phone calls, through other kinds of internet, or even texting to maintain connections with people. Exercise emerged as its own category, simply getting physical exercise. Religion and prayer emerged as its own category in these analyses. Denial emerged as its own category, and this was a combination of saying, yeah, I don't know, I'm just really wondering whether this is as big a deal as everybody's saying it is, or acknowledging that it's a big deal, but saying, yeah, but I don't think it's going to happen to me. This is somebody else's problem, or if I get it, it's not going to be that bad. And then the final category we called defeat. And this is really just giving up. So this included 2 specific strategies. One is really just saying, I've given up trying to cope with this situation. And then the other is substance and alcohol use. So those were the 7 categories. Which were used most often? Well, it turns out that the most often used strategy was seeking positive affect, engaging in that battery of ways of thinking about the situation and then ways of acting in the situation that tend to increase the experience of positive emotion. The next most used strategies were information seeking and what we call active coping, right? This is the problem solving category of strategies, and exercise. Next up was social connection and prayer, religion. And then finally, down at the bottom, which is good, least often reported were the strategies that are most passive or potentially toxic, right? So denial and defeat. So those are the ways that people reported coping with the coronavirus pandemic over the course of the first few months that this was going on. Which of these strategies were associated, again, just on day 1 with better psychological well-being? What's interesting, because it really kind of depends on which aspect of psychological well-being you're talking about. Several of these batteries of strategies were correlated with higher self-reported positive affect. That included the use of action-focused strategies. Not surprisingly, it included positive affect inducing strategies. That's sort of the point of those strategies, to increase the experience of positive emotion. It also included exercise and religion. Negatively correlated with the experience of positive affect was defeat. And again, that's not terribly surprising. We see a somewhat different profile when we ask not just, did it make us feel good, but did it reduce our feelings of distress, both in terms of positive affect during that day, and also was it correlated with lower emotional disorder symptomatology and stress during the preceding week. And there we saw a more specific pattern. So as a general rule, reliance on positive affect inducing strategies was associated with lower symptomatology. These relationships were significant for depression and stress, but they were also in the negative direction for negative affect and anxiety. Similarly, exercise, simple physical exercise as a way of coping, was actually associated with lower reports of mental health, negative mental health symptoms in these domains. two strategies were associated with higher reports of mental health symptoms. Those were actually social connection. And again, the direction of this effect indicates that the more you were reaching out to other people to help you cope with coronavirus-related distress, the more negative affect, depression symptoms, anxiety symptoms, and stress you were reporting. And then, not surprisingly, the more you reported feeling defeated and using defeat-related strategies, including alcohol and substance use, the more of these symptoms that you were feeling. And I'm going to come back to the nuances around social connection shortly, because that's really quite complicated. The last thing that we looked at, though, and this is again part of that complication, is when you consider relationship closeness as an indicator of well-being, which it most certainly is. So this particular item asked people to indicate how close they felt to the most important people in their lives during the last 24 hours. And here, social connection does a flip. Again, the reliance on positive affect inducing coping strategies was associated significantly with higher closeness to your most important loved ones, but so was the use of social connection strategies. So this suggests that it may not be helping a whole lot with the alleviation of depression, anxiety, and stress, but it is consistent with feeling closer to people, and that may have important long-term benefits. Let's turn now to implications for healthy lifestyle behaviors, which is a somewhat different question. And we actually see a somewhat different pattern as well. Here, fairly few of these strategies were associated with behavioral outcomes. And I should mention that these associations that we're seeing were not examined one at a time. For each of the behavior outcomes you see as a column here, and the same is true for the well-being outcomes in the previous slide, we actually entered all of the emotion regulation categories that you see as the rows as predictors at the same time. So we're really looking at pretty much unique effects of each of these strategies after controlling for all of the others. And we found something really interesting for social connection, and that's that the people who were relying more strongly on turning to relationships specifically to make them feel better when they were stressed out about the coronavirus, they were also eating more sugary snacks and consuming more high sugar beverages. This is actually consistent with an experimental study that my lab did last fall, before any of this started, where we instructed people in using one of a few different emotion regulation strategies, including social support. It was imagine someone you really love giving you a hug and telling you it's going to be okay. And then we put them in a stressful situation and doing a stressful, difficult, and tedious task for about 20 minutes. And we put a basket of snacks in front of them that included both candy and healthy snacks like nuts and apples and popcorn. And what we found is that the instruction to imagine being hugged by a loved one not only didn't decrease candy intake, it actually increased the proportion of snacks that were candy. So this is actually very consistent with this finding. And defeat in general was also associated with worse behavior. That's not a surprise, especially the alcohol one, because remember that defeat is defined in part by having used alcohol or another substance in order to make yourself feel better. So it's not really surprising that that's correlated with higher self-reported daily alcohol intake. Exercise in general was negatively associated with these health outcomes, these negative health behaviors, and that was significantly the case for intake of sugary snacks. Now, that's probably because, as a general rule, people who exercise more on a daily basis also tend to have better lifestyle behaviors in other domains as well. So that may be an association that doesn't really have anything to do with the pandemic. We're not making that assumption right now. But this is where this gets really interesting. So recall that we also looked at some coronavirus specific behaviors. And one of those that I particularly wanted to focus on for this talk was hygiene, right? So this included things like, are you washing your hands carefully on a regular basis, especially after going outside or touching things outside the home? Are you wearing a mask? How often are you wearing a mask when you leave the home? It was those kinds of items that reflected CDC recommended hygiene related behaviors. When we made an index of those, what we found is that people who were relying more on action-focused coping strategies were indeed reported, at least told us that they were enacting better use of hygiene behaviors at the baseline level. And the same was true for social connection. So people who reported turning more to relationship partners when they were in distress as a way of dealing with their emotions also reported using better hygiene behaviors more often that were coronavirus specific. So that's a lot of data that I know that I just threw at you. So let's talk about what some of the take-home points are. The crucial take-home point for this, for me, is the difficulty of talking about any particular emotion regulation strategy as good or bad. And this is an idea that is fairly new in emotion regulation and coping research. There are meta-analyses, there are reviews of the literature that ask, in a very general sense, which coping and emotion regulation strategies are associated with higher well-being in general, in normal daily life, regardless of the situations that people are in. And those analyses identify certain strategies as being associated in general with higher well-being. And there's some of the ones that we've talked about today. But in the last few years, there's been a growing acknowledgement that the appropriate coping strategy is going to depend to some extent on the situation that you're in. And a strategy that looks problematic in one situation may actually be very appropriate for another one. So here's one example. As a general rule, positive reappraisal, thinking about the benefits that a situation can provide, and reappraisal in general, is associated with higher well-being. Unless you're in a situation where you actually objectively have a lot of control. In those situations, it's not predictive of higher well-being. And the suggestion here is that it may be that reappraisal makes you feel better, does a really good job of making you feel better. But in doing that, it's possible that it actually nudges you toward bypassing opportunities to take control of the situation that you might have. So it has benefits and it has some drawbacks. And the relative implications of those benefits and drawbacks are really going to depend on the details of the situation that you're facing. And there's no one size fits all solution in terms of coping strategies. Now, I want to express one caveat with the data that we have so far, and this is really important. Because I'm just looking at data from the first day of the questionnaires, because participants answered all of these questions at the same time, I don't have strong evidence right now about causal directions. So I can't comfortably tell you that these different emotion regulation and coping strategies caused the changes or differences in well-being and behavior that we were seeing. When I have a chance to finish processing and analyzing all of the data that we have over those 22 days from folks, then we'll be able to look at predicting changes over time. And at that point, I'll be able to come back with some stronger evidence about causal direction. And we are also hopeful that we might be able to begin thinking about what an intervention, a healthy intervention, would look like that can help people adapt to the situation based upon the data that we have. With that caveat in mind, let's summarize what we've seen in these data so far. And I'm going to group this by clusters of strategies that we have. And the first major point to emerge from this, for me, is about positive affect and exercise. So the positive and affect and exercise strategies were associated with higher well-being across the board. And that included both feeling more positive and feeling less stressed and distressed. But these strategies, except for exercise, were largely unrelated to behavior. Exercise was somewhat related to overall health behaviors, but not coronavirus specific behaviors. And that suggests to me that people who exercise also tend to drink less and smoke less and eat healthier diets. That's a well-established finding. What about social connection? Something I've really been emphasizing since the beginning of this talk. Again, a somewhat complicated profile. higher reliance on social connection was associated with lower psychological well-being, specifically in terms of higher symptoms of depression, anxiety, and stress. It was also associated with more intake of added sugar. But at the same time, it was associated with stronger feelings of closeness with loved ones and better hygiene, coronavirus pandemic-specific hygiene behaviors. And I want to be really clear about something right now. I am not suggesting that we should avoid healthy social connection. That is absolutely not the message that I'm sending. The evidence that healthy social connection is crucial for emotional well-being is widely established. But what I am suggesting is for coping purposes, for the purposes of dealing with distress, perhaps it should not be the only or the primary strategy, that some of these alternative strategies can be useful at dealing with distress and reserving the social connection for positive engagement and making sure that both of those things are going on. So that's a question that we'll be addressing in our follow-up research. Finally, I'll talk about action-focused strategies. These were okay for behavior, as we saw. The use of action-focused strategies was associated with higher positive affect and also better use of hygiene behaviors. Not surprising, since it included information seeking and a focus on what can I do to make this situation better, but it was largely unrelated to well-being. Where are we going to go with this, right? There's still a lot of work to be done. Again, the crucial point here is I don't think that there's any one-size-fits-all coping and emotion regulation strategy. And as we talk about advising others on how to cope with challenges and stressors in their lives within the pandemic and beyond, I think we need to be encouraging people to learn about the range of strategies that are available and teaching an ability to use diverse strategies as needed, that may be the message that we want to be sending. And ideally, helping people work through algorithms of, oh, this is the situation, this is the strategy that I want to be using. So I think that really what we want to be providing people with and encouraging them to use is more of an emotion regulation toolkit rather than a single one-size-fits-all strategy. So I'll go ahead and end there. I do want to thank Keith and Angel and Mitzi and IMHR for encouraging me to share our research with you today, certainly for supporting the work that we're going to be doing. I want to thank the National Science Foundation for supporting this work thus far. The research was conducted in large part by two graduate students, Erica Pages and Carly Vornlocker, who put an enormous amount of work into this over the summer and over the last few months, and my lab. And of course, I want to thank you for joining us today.
All right, Lani, thank you so much for that. That was really wonderful. I know that there are numbers of people that probably have questions that they would like to raise. And I'm going to encourage everybody, if you have them, to please enter those into the Q&A. And we'll wait for those to turn up, and we'll try to get to as many as we can. But in the meantime, all right, there's so many things that strike me as interesting from the work that you've described, right? And there's so many different things that we can talk about. One of the questions that occurs to me is, do you know anything about, from your research findings so far, whether or not it makes a difference how stressed somebody is by the pandemic, right? And looking at what they wind up doing? Did I imagine there's got to be differences between those people that feel a lot of stress by it or those people that don't, in terms of what they're doing coping wise, or whether that's meaningful for coping?
So I have not had a chance to look at this in our data yet. And it's an outstanding question. It's a really important one. I talked about what we call moderators, right? Factors that change the nature of the effects between two variables, in this case, coping strategy use and well-being outcomes or behavioral outcomes. And I talked about the situation, right? What's the situation that you're dealing with as one moderator? But how stressed you are is another one. There is some work on this previously from other researchers. And basically what it suggests is that the more stressed out you are, the more you want to rely on strategies that are a little easier to implement. There are some strategies, reappraisal is one that comes to mind, they really take a lot of mental bandwidth to implement. If you're basically saying, well, wow, this whole staying at home thing, this is just a mess, and I have to deal with these technology issues and my dog barking and my kids at home and how, and getting my space ready for this. If in order to say, okay, pause, wait a minute, are there some advantages that I can think about in the situation? That takes some mental bandwidth that people may not have when they're in the moment feeling very, very distressed. And we already have some research, some work I have done shows, for example, that older adults tend to be better at enacting positive reappraisal than young adults. They probably have a wider range of life experiences to draw from in that. So in contrast, distraction, when you're very, very distressed, can be somewhat more effective, because you're not saying just don't think about it this way, or now I have to generate something, a different way of thinking about this. It's you're going to put something in front of me that is going to require my attention. I'm seeing a comment in the chat about yoga. I love yoga, and I love yoga because if I'm not paying attention to what I'm doing, I am going to fall over. And so in order to do it at all, your attention does need to be focused, and that can be great. Again, it suggests that maybe what we want to think about doing is even a sequence of emotion regulation strategies. First, let me calm down, right? And then let me think about planning what I can do in this situation, or reappraising it as a strategy for the long term. That's a great question.
So do you see, anything that's uniquely pandemic specific to the coping things, right? I mean, I think that what's really interesting about this is that the pandemic is a unique experience for humans in the past, for us anyway, right? In the United States, let's just say, in the last 100 years. Okay, so we think we know a lot about coping, right? Because it's been studied for a long time, right? Even though we probably don't really know as much as we think we do, right? But right, we haven't really had this as a stressor before. So there's probably very unique things about the pandemic itself, right? So, I mean, can you talk just for a second about your thoughts about what might be unique to these pandemic related experiences as they affect coping processes?
Absolutely. I think there are two things that are really crucial. The first is isolation. We've had a lot of stressors in the last 100 years, but since the flu epidemic of 1918, we haven't had one where you can't go to your family members and your close friends and get a hug. That's a very, very big deal. And it may be part of the reason why a tendency to rely on social contact as your emotion regulation strategy could be compromised right now. If that is your go-to strategy, and I have plenty of early research that suggests that most people have one, maybe two go-to strategies that they rely on. If seeking social support is your go-to social strategy, and your means for getting that support are so cut off, that's going to be problematic right now. And I think that's part of what we're seeing in our data, is that the strategy itself is simply not as effective under the current circumstances. At least it wasn't in May through June. It may be that people are kind of figuring out some more solutions for that now, and that may be something that we can assist people with. The other thing is that this is a scenario in which there are very limited domains of control. I don't want to suggest that we have no control. There are areas in which we have a great deal of control. We can wear masks. We can decide how we're going to get our groceries. There are lots of things that we can do. We can enact behaviors that protect ourselves and our families to the greatest extent that's feasible. But we can't control the economy as individuals. We can't control that. We can't control other people's behavior. And I have friends who go absolutely bananas and feel an enormous amount of anger and distress simply walking around and seeing other people who are not wearing masks. We cannot control the political situation that has implications for regardless of what side of the aisle you're on, there are frustrations that you have about how this is being handled, both at the federal level and the state level. So there is so much about this that we can't control, and that is hard. Humans need to feel, it's a fundamental aspect of our well-being, feel like there's something that we can do to influence this situation. And the reality is that there's lots of domains where we can't. I think that's one of the reasons why we're seeing very little effect of active coping, right? Of problem solving, problem focused coping in our data, because people may be trying to use problem focused coping in a situation where there's really not much that we can do. And the only effects that we are seeing are on the parts that where it is actually something that you can do. So one thing that I recommend in general is in a period of any period of great stress is taking the time to pause and say, what can I control? What can I do realistically? And what do I have no control over? Basic serenity prayer, right? God grant me the serenity to accept the things I cannot change, the courage to change the things I can, the wisdom to know the difference. That wisdom is so important right now, because identifying the things you control and doing that, and then finding another coping strategy for the other stuff is going to be a crucial trick at this time.
Yeah. Well, we've got a number of people who've submitted questions, so let me run a few by you, okay?
Sure.
All right. All right, so we have a question from Morgan who asks, does gender have any impact upon these relationships? I'm thinking specifically about rumination as a coping strategy, and that women are more likely than men to ruminate.
Such an important question. I have not had a chance to look at it yet, and it's very high on my list, because absolutely, we certainly expect to see gender differences. There's tons of data suggesting that as a general rule, men turn to problem-focused coping, action-focused coping more than women do. Women do rely on rumination more than men do. I think we may end up finding that positive reappraisal, positive affect-focused coping varies somewhat by sex, although it may depend upon the particular strategy used. So we will certainly be looking at that. Do I think we're going to find gender differences in the relationships between coping strategies and our well-being outcomes and our behavior outcomes? There, I'm a bit more skeptical. It's possible that for women, reliance on social coping will have different effects than for men. But I'm a little skeptical about that too. I think we sort of tell ourselves a story where guys need intimate social contact less than women do. And I'm a little wary of that. I think that women there's lots of evidence that women have more dispersed coping networks than men. So there may be a difference in reliance for that reason, right? And there is actually already evidence that guys are adapting better to the coronavirus pandemic than women. It may be this, that men's primary social support systems are often within their nuclear families, particularly their partners and spouses. Whereas women, they tend to be more dispersed among a wider range of family and friends with whom there's more cutoff in terms of contact. So that could have implications, but we'll absolutely be looking at that in the weeks ahead as we continue working with these data.
Okay, I know you spoke in relation to one question about yoga, right?
Mm-hmm.
Previously, but Francine also has a question about what about meditation? And I don't know whether or not you have more to say about meditation as an issue, but I'll ask that question for her.
It's a great question. People who were relying on meditation, that would have shown up as religion. In this particular, in the way that we asked the question, meditation would have fallen under prayer. We did not have a separate category for meditation, unfortunately. I think it depends to some extent on which version of meditation you're talking about. If it's mindfulness meditation, there's some interesting research on short versus long-term effects. So it is demanding. It's not unless you're a very practiced meditator, it's not necessarily an easy thing to do. And people can become frustrated with the process, and they can also ironically be more aware of distress that they're feeling, right? I mean, mindfulness is mindfulness of whatever it is that's going on with you. I think a useful way to think of mindfulness is the acceptance component of mindfulness. I am not only aware of my feelings are okay. I embrace them. They are as they are. They do not require validation from anybody else. I accept them, and they do not need to control me. They are here in the moment and they will pass. That attitude toward one's own distress can be helpful in putting a buffer between your emotions and your behavior. It may not change the emotions. I think the jury's kind of still out on the extent to which acceptance, generally speaking, of your emotions is associated with actually feeling better. There's a lot of conflicting evidence on that. But what it may do is give an opportunity to put a barrier in between the emotions and how you act that can be quite useful in some situations.
Okay, great, thank you. All right, so we have a question from one of our attendees that says, thank you for the fascinating information and your commitment to positive research. Can you tell us about the challenges related to acquiring funding for your innovative ideas? Oh boy, that's a great one. Has the economic impact of the pandemic created more or less funding for this kind of research?
It created more.
Yeah,
Now, I don't know how long that's going to go on, but the National Science Foundation, normally the funding process is excruciating, let's just say. I mean, it can take months to develop an application. They are anywhere from, 10 pages to 15 pages. That's just describing the research, not all the other docs that have to go with them. And it can take months to years. NSF has a program called the RAPID program that is geared toward working with program officers to develop very short, very quick turnaround requests for funding that are tied to a particular ongoing situation. And they made that available very early in this process. So the grant that I have is a RAPID grant. I was able to just go to a program officer and say, hey, I've got this idea. Are you interested? And we went back and forth. They actually helped me to refine it and talk about the methods that they were comfortable with and the expectations that they had, the budget constraints and all those things. And it was great to get just direct feedback from them on this is what's going to fly with us. It's only an internal process. They don't send it out for review. So I think the whole process took about 6 weeks from first contact to, yes, you're going to get the money.
Yeah, that's great. Well, so it's good that the federal government anyway can run quickly with an idea if they.
Now, I will say there's a caveat. To my knowledge, NIH doesn't have anything like that.
Right.
And I don't know. And again, I don't know that funding is still available now. So if part of your question is there still a need for more funding for this kind of work? The answer is absolutely. Because these government supported things they're capricious. Let's just put them that way. They can happen and there's a big burst and then they're gone, even though the work really does need to continue.
Right. And one would imagine that a lot of the work that's being funded right now is much more on the snapshot variety than the long-term, longitudinal, important long-term outcome things that we won't have answers for years, really, that we need the work to be done.
That's exactly right.
Yeah. So here's a really interesting question submitted by one of our attendees. Is there any thought being given to the emotional impact of the adopted term social distancing, right? Since humans crave or need social connections, would the more accurate term of physical distancing have had a lesser emotional impact, do you think?
It's such a good question. And it was raised. It was actually raised. I'm in various different social media groups of social psychologists, and a bunch of people kind of went, whoa, 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 terminology matters. I'm not sure we want to use something that's quite that negative. And unfortunately, once the term gets out there, it doesn't catch on. I think that it may have, I don't know that the term had substantial emotional consequences in its own right, but I think it gave a negative association to the behaviors that people were being asked to do that was problematic. And I will say that although the messaging has been stronger in some places than others, but there has been a great deal of messaging on the importance from a public health standpoint of keeping your distance. There has not been enough messaging on here's how you can connect with the people that you love. Here's how you can safely maintain relationships. I think more messaging around that and more framing of the recommendations in that light from the beginning would potentially have been very, very helpful.
Okay, great, thanks. Okay, so I have another, I won't say it's a question, more of a comment, okay? And then maybe you could respond to this, because what I think it does is talks about someone's more sort of framework of sort of the adaptation and adjustment in a positive way, right? But from Amy, who writes that she has seen tremendous growth and maturity in my young adult children, she writes. One is a doctor who is to be married next spring, and another whose focus on her art has had positive outcomes. The wedding is now being viewed for more realistically. Although we have not seen one another for almost a year, the quality of our conversation is deeper and we feel closer, right? So how does that relate to the kinds of things that you find yourself working on?
It's such a great point. I mean, people do adapt, and there are huge individual differences in how people are responding to the situation. I will tell, it's a joke in our household. My husband's fine. He's he's dispositionally introverted and prefers a very, very consistent routine. There's certain things about, before March life that he misses, but on the whole, he's okay. It's been much more challenging for me. I hear from friends who have multiple kids that their kids are dealing with this very differently. You've got one kid who actually really kind of likes the whole online Zoom school thing and thrives in that environment, and others who are just miserable. So I think the trick, and something that we're not always great at in our public health messaging, is how can you adapt in a positive way? Not what should you not be doing. We're great at fear-based messaging. Don't smoke because you'll get lung cancer and die. You need to exercise because otherwise you'll have a heart attack, right? Don't get together with your family for Thanksgiving. We're very good at messaging that says don't, and we're not so good at messaging that says do this because it will have this positive reward that you will acquire. So what we end up coming down to is that there are individuals who are naturally oriented that way, right? Who have both the personal resources and the social and environmental resources to be resilient. So if that's where your kids are, I applaud you, because it means you really did some things right in raising those young adults to be able to adapt to situations, find opportunities, and problem solve. And that's a real resource. It's going to benefit them throughout their lives. I think that we as a society and as an education system can do better in helping a larger number of individuals develop those skills and have those resources available to them.
Great, thank you. Look, I'm going to do one more question, okay? And I think that you've touched on this just a little bit, but I think that it might be good to hear a little bit more of your thinking about this. But one of our attendees writes that you really emphasize coping strategies that increase positive emotions. Isn't that just pretending that everything is okay, right? And how is that really different from denial? So I know you touched on that a little bit, but maybe you could expand a little bit.
Yeah, it's a great question. And one I get asked a lot, because a good amount of my work is on both positive reappraisal and savoring, two of the specific categories that I mentioned earlier. I really want to emphasize this, that neither positive reappraisal nor savoring nor humor involve pretending that the bad situation isn't bad. In fact, they may allow us to say, wow, this is a dumpster fire. This is just a horrendous situation. And in order to take care of myself and remain resilient, I need to create a pocket of positivity about this. I need to maintain balance in understanding that there is distress that is legitimate, that this is a difficult situation, and that I can make something good in this. The initial interest in this category of strategies, these positive affect-inducing strategies, actually came from a researcher named Susan Folkman at the University of California, San Francisco, and she tripped over them. She wasn't looking for them. She was doing work at the time with caregivers of AIDS patients in the 90s. And just as a reminder, we didn't have antiviral cocktails then. a diagnosis of HIV positivity was a death sentence. And once you had AIDS, it was a slow, excruciating downhill. And you were watching your partner go through this and providing care, or your loved ones go through this and providing care during that time. And she was doing this work really at the border of anthropology and sociology and psychology, trying to understand what this experience was like for caregivers, asking them about how hard it was. And what they said to her was, boy, you're asking us all about the really hard stuff. But we have good days. We have good, joyful, beautiful moments. Why aren't you asking us about those too? And she said, oh, yeah, tell me about that. And what she found is that caregivers who, in this extraordinarily painful, stressful situation, reported making time in their day for savoring, creating meaning, understanding how this experience was related to and part of their larger worldview, and then focusing on positive outcomes, which included closeness with the person who was sick, growing interdependence and intimacy, that those folks not only were doing better while their partner was ill, but after their partner had passed away, they recovered and were doing better more quickly afterwards. So there's actually a long history of evidence regarding these strategies.
Well, Lani, thank you so much. This has been marvelous. I think you've been terrific, and very informative. And I'm sure that everyone who spent time with us today thinks the same. So thank you so much for your time and everything that you're doing and for being one of our investigators. And now let me turn it over to our board chair.
Great, thank you. I'm going to try to start the video. Can you can hear me?
Yes.
Okay. Hopefully we can. Let's see if that works. Angel, I think you need to start my video for me. You have the control. Oh, okay. Now I have the control. There we go. Hi. First of all, again, I just echo that, Keith. Dr. Shiota, that was just amazing in terms of the information. And I couldn't help but just, check off the kinds of things that my family and I are doing and the ways that we're coping and seeing how we cluster, if you will. So thank you for that. And I think that that was a lot of good information. I know it was a lot of good information. I do want to let folks know, though, that if you or someone you know is having a really hard time and not finding solace in their emotional toolkit, if you will, that these are resources that are available to everyone. And you might want to take a screenshot of that if you'd like. We will also post this on our IMHR.org website as well. I also want to thank everyone here for being with us. If you want to join us in furthering mental health research and supporting the incredible talent that we have here in Arizona, like Dr. Shiota, we invite you again to check out our website at imhr.org. And we just opened our Merch for Research store with proceeds benefiting IMHR, so that if you can do a twofer, you can help support us as well as get the word out how important mental health research is. And that's also on the website. On November 18th, our third webinar explores the topic of resilience with Dr. Felipe Castro, and Dr. Shiota alluded to the importance of that as well. Dr. Castro will provide the results of his research and takeaways for how we can best draw on our own resolve during this pandemic. We will be sending you registration information. We hope that you'll join us, and we hope that you'll also invite your friends and colleagues and share that with them as well. We hope to see you in November, but in the meantime, stay well and best wishes for your health and well-being. And again, thank you for joining us.